Take a look at this echocardiography of a patient with a history of bioprosthetic mitral valve replacement. Although traditionally considered uncommon, bioprosthetic valve thrombosis is increasingly recognized. Indeed, bioprosthetic valve thrombosis is more common than many clinicians assume. A careful evaluation of the bioprosthesis in this view reveals a few hypermobile masses floating on the ventricular side of the valve. In this view, we are seeing those hypoechoic masses. It's worth noting that thrombosis has been reported in as many as 11.6% of explanted bioprosthetic valves. Subclinical leaflet thrombosis can occur without obvious symptoms. However, they can predispose patients to a stroke, peripheral emboli, or hemodynamic deterioration. An increased mean gradient above 10 mm of mercury or a peak velocity more than 3 m per second can be a clue to these insidious clots. Other echocardiographic hints might include increased turbulence across the valve, restricted leaflet motion, or detecting echogenic masses on the valve itself. On this transesophageal echocardiographic view, we are seeing a hypermobile echogenic mass on the prosthesis. Risk factors for bioprosthetic clot formation include atrial fibrillation, a large left atrium, left ventricular dysfunction, and a hypercoagulable state. Even though that initial 3 to 6 months after surgery is important, you really want to keep an eye out long term. Most of these thrombosis cases actually show up after the first year. In this 3D echocardiographic view from the ventricular side, you can see a floating clot attached to the cusp. Differential diagnosis of thrombosis include pannus and vegetations. A pannus tends to be more echogenic and fixed, while vegetations are usually linked with fever or other echo signs of endocarditis. This 3D view illustrates the mitral valve prosthesis as seen from the anterior aspect. Even if you don't see any obvious masses on imaging, a progressive increase in Doppler gradients should raise suspicion of bioprosthetic clot formation. Also, a gradient rise that is disproportionate to structural degeneration. That's another clue that something else might be going on, like a thrombus. Sudden leaflet thickening or immobility can also be an echo sign of clot formation. In conclusion, bioprosthetic valve thrombosis isn't rare, it's under-recognized. Subclinical leaflet thrombosis may be the beginning of a catastrophic clinical complications, and the risk of clot formation persists beyond early post-operative period, even years later.